Welcome to a technical dialogues that is part of an extended consultation on technical assistance and the health supply chain workforce. The topic for today is human resources and advocacy, and I have the pleasure of introducing you our panelists. Dr. Kate Tulenko, who is a physician executive and founder and CEO of Corvus Health, a global health workforce firm. Kate was also the former director of Capacity Plus, a U.S. government global health workforce program, and a former coordinator of the World Bank's Africa Health Workforce Program. We also have Dominique Zwinkels, who is the executive manager of People That Deliver, and she is going to be able to tell us a little bit more about the important role that People That Deliver have in bringing different institutions, different organizations to work together around the issue of the supply chain workforce. So welcome, Kate. Welcome, Dominique. And to start up the conversation, Kate, there's a lot of confusion many times on what is human resources, what is human resources management. So let's start with that question.
Okay, well, first I'll start off with what is human resources for health. The World Health Organization defines HRH, or Human Resources for Health, as any person working in an organization that the organization has as its prime mission, the advancement of health. So that means anyone working in a hospital, a pharmacy, a manufacturer of medical devices is considered an HRH, or Human Resources for Health. So it includes engineers and administrators and other types of workers, as well as the more classic physicians, pharmacists, and nurses. And then human resource management is the management science that spans the entire lifespan of the health worker. So human resource management could be defined as the planning that goes on at the national or the institutional level for what type of workforce a health system is going to have. It includes the financing of the health workforce. It includes the pre-service education of the health workforce, medical school, nursing school, pharmacy school. It also includes the recruitment of health workers. And then once they're onboarded and working, their performance management, employee handbooks, benefits, salary, payroll, and then of course, retention of health workers. So it really does cover that entire life cycle of the health worker.
Kate, in your past experience around the world with human resources, what are some of the lessons learned and considerations regarding working with governments and the public health supply chain workforce?
Okay. I think there are probably three main points, especially from a logistics point of view, from sort of the people that deliver and supply chain point of view. The first is that pre-service education is not enough. That in-service training is not enough, that we have to actually go down to the level of pre-service education if we want it to be sustainable. There's often such turnover in organizations, whether it's the central supply store, the Ministry of Health, or a hospital, that you can't rely on training people in service. You need a robust system of pre-service education that can create enough people to meet the needs of the country. And then another thing important to keep in mind is just how complex the workforce is for supply chain and for the health sector in general. For example, just looking at supply chains, it's not just one type of profession you need. You need close to a dozen. That would be procurement experts, contract experts, pharmacists. You need the supply chain managers, you need warehouse managers, you need data enterers, you need data managers, you need the transport workers. So it really is quite complex from a human resource point of view. And then the third main point is that you have to look at the whole of the labor market. It's not just enough to address the supply chain or the HRH labor needs for the Ministry of Health and the public sector. You have to look at what the private sector is doing. You know, it's sort of a global joke that wherever you go in the world, you see a Coca-Cola, that they have this incredible supply chain. And it's true as well for the private sector and health as well. They often have more robust supply chains than the public sector, and the public sector can learn a lot from them. And also, if you're not careful, the public sector can hire away a lot of your supply chain workers. And so by making sure that you take this whole of labor market approach, that you produce enough supply chain workers for both the public and the private sector, you'll make both of them more robust.
Thank you, Kate. Now, Dominique, could you please share with us some of your experience and tell us a little bit more about People That Deliver?
Yeah, of course. So Kate gave a great background of of the needs and the labor market for the health supply chain. But People That Deliver today is a coalition of organizations that's working to build the capacity of the health supply chain workforce, but also very much promote the professionalization of the supply chain role within the health system. Those are sort of the two mandates that we're working on. It originally started back in 2011 it was a World Health Organization where almost 80 institutions came together and they pledged their support to this cause. From there, we've moved into, we're now almost 10 years later, we've moved from being very heavy on the advocacy side to now being known as sort of the human resources, a technical lead, or let's say technical lead for human resources and supply chain management. And so we're governed by this, like I said, a coalition now. We just made a huge governance restructuring decision. And we have a coalition that's open to any organization that is willing to build that capacity, willing to do that advocacy, et cetera. And currently we have 20 organizations, but we're going to be expanding as we can. We also have a new chair, a new deputy chair that just joined us just this week. So that's really exciting. So new leadership, so new chances. We are housed by the UNICEF Supply Division. In the early years, we were housed by a small French NGO. And then a number of board members started looking around to see where would be the best place for People That Deliver. And we found our home in UNICEF, and it really works very well. It's a neutral platform. We're embedded within the what we call the Supply Chain Strengthening Center. So we have access to professionals that have all kinds of supply chain expertise in the different areas. And of course, we have all these coalition members that provide both sort of the expertise as well as the networks in order to get our message out. And I would say over the last few years where I've been the executive manager, we've really focused on how can we ensure that change is happening at the country level. And we have developed some very foundational methodologies, let's say. In the early years, it was all about building a framework for the competencies. And now we've really developed a theory of change as to how we can link these investments that are being made in human resources for supply chain to health outcomes, and what are sort of the different interventions and indicators that can be tracked to make sure that we're making an impact with these investments. So I'll leave it at that for now.
Yes, a couple of things, because it's Kate mentioned it as when you deal with human resources, you deal with different types of competencies, and it's complex. And when you're talking about and describing People That Deliver, you're talking about this network of institutions, this collective element that focuses on, that have a common focus, but that each one brings something to the plate. Why is it so important to have this broad range of institutions working together?
Well, I think the dynamic has changed over the years, but originally very much we found that even though there was like millions of dollars worth of commodities flowing through supply chain, the critical strategic function of the supply chain within the health system was not acknowledged, and we just found that within the workforce, there weren't the technical and managerial competencies were not necessarily there. A lot of countries sort of faced significant gaps in the technical capacity as well as knowledge within their staff. It was also that professionalization piece where there's no global standard for the health supply chain workforce. And it's often just done on an ad hoc basis by professional associations. Or there's a little bit of regulation, let's say, for clearance agents or for pharmaceuticals, but there's no sort of body that's overseeing that. And so there was just, collectively these organizations came together and said, well, there needs to be a focus on this. As Kate mentioned, there is such a wide range of different professionals that are needed for a well-functioning supply chain. And we need to, be focused on that to ensure those competencies are being built and that professionalization is in place.
Thank you, Dominique. Kate, in your experience, what is the importance of these global standards when applied at the country level?
Well, these types of standardizations are very important for two reasons. One is it gives ministries of health standards to shoot for and sets a bar for them, but also, and perhaps more importantly, it helps advocates in country to advocate to the ministry or to others that change is needed and that these standards are needed. Because in the absence of those standards, it's really very difficult for advocates to argue that serious change is needed. So I think that's the real importance of the standards. And it's so important that people that deliver is in UNICEF, in the UN system, has a relationship with WHO, so it can come down from, through these official channels, and it's not just recommendations that academics are making, that is, it's come through the UN system. And, I think as far as on a practical level, often if in addition to advocacy documents and advocacy talking points, people on the ground need tools and documents that they can use, maybe sample job descriptions or sample team designs, these real practical standard operating procedures that they can use, because sometimes an agreement's made to move on something, but then no one knows what to do after that. So we really have to look at the practicalities.
Yeah. Thinking of the subnational levels and the community levels, how can we develop those capacities of the workforce that's already within the system, while other cadres and professionalization approaches are being put into place?
I think the people that are already in the system, usually it's support supervision that can build their capacity, and also the in-service training. But support supervision is the type of support people get on a regular basis, whether it's daily or it should at least be weekly. They should have contact with their supervisor, whether face-to-face or via mobile phone. When the supervisor says, how did your work go this week? What were your biggest victories? What were your biggest challenges? How can we work on solving those challenges? And often there can be education around solving those challenges. So I think that support supervision is helpful. Also the in-service training or the continuous professional development. Dominique mentioned the importance of professionalizing many of these professions. Many of these professions really are unrecognized. They don't have a voice in the ministry. There's not a professional association. There's not a career path. And as you move to professionalize them, you create all these things, and you create, often accreditation, regulation, a mandate for continuing professional development, so that they do need to advance and they're not practicing the science that they were taught 20 years ago and don't have the latest updates. So I think that support supervision and the continuing professional development can be helpful. You also, in the first part of your question, mentioned, reaching down to that last mile and how we do that. I think there are two things that make that easier. Certainly now with, the advent of almost, in many countries, almost universal mobile phone access, the fact that someone in the ministry or in the capital can directly call someone at the village level, give them support, get data, that is a huge change. And then also the second way to reach them is once again through this, the support supervision in those regular channels.
Dominique, as we head towards the end of this conversation, what message would you like to transmit to our viewers regarding People That Deliver and its mandate?
Yeah, of course. I would say if you are part of an organization that is interested in being part of the coalition, that do absolutely reach out. We're actually going to be opening up membership in the next 2 months. But I think that another way is participating or working with different networks at the country level that are implementing some of our tools and resources that we have developed over time. So I just wanted to speak to you about what a framework that has recently been developed by us in collaboration with USAID, the PSM project, as well as SAPICS. And it's the Supply Chain Management Professionalization Framework. And that speaks very much to what Kate was speaking about, where, as I mentioned earlier, we saw that there is no sort of global standards. And we're trying to build that through this framework where we're aligning, a set of the core competencies with education, and then also a career pathway, designations showing that, you can actually mature from a very junior level to a more senior level. And finally showing, people that are interested in a career in supply chain, that there is a career pathway. And then, of course, ensuring that institutions are aligned with this thinking. So this is going to take a lot of advocacy, lots and lots of advocacy. But we're very keen on working with national institutions and different organizations and networks at the country level to see if this is implementable. And actually, finally have a vision for what was set out back, in 2011 for PCD.
Kate, to finalize this conversation, let's look at the future. How do you see it? Where do you see innovation, not only technological innovation, but systems innovation playing a role in terms of developing the capacity of the health workforce?
There are a lot of changes I see in the future, both for health workforce in general and for supply chain health workforce specifically. One is more sophisticated teams with more division of labor. People are more highly specialized. When you have a more educated workforce, you can do that, and you often get efficiencies from that. We're also going to see more computer systems and artificial intelligence helping to support people in their decision making. And when I look at the role of artificial intelligence in healthcare, I don't see it replacing people. I see it augmenting their decisions. So I don't see it as a threat. I see something that's going to improve quality and improve speed. So those are some of the big changes I see. Also, another change as far as employment models in the supply chain. I would see more countries move from the government employed central medical store to contracting with private companies. And so a lot of these jobs will move from the public sector into the private sector.
Thank you, Kate. Thank you, Dominique. And with this, we come to the end of this technical dialogue on human resources and advocacy. I hope that the content will be useful for our discussions, and I look forward to hearing your comments.
Thank you. It was a pleasure.
Thank you, Aleti. Thank you. Bye-bye.
Take care.